Hello, Mr. Allen.
Call me Pam.
Clifford.
Sure. So, Pam, you're going to be having some surgery tomorrow, and we need to go through a few things today to get you a little bit more prepared. I'm going to be asking you some pretty personal questions. Are you happy for Clifford to stay?
Sure. Yep.
Okay, great. So, how are you feeling? Looks like you've had a pretty rough day.
I'm okay. Frustrated that I've got cancer again. I'm pretty scared because I know how sore I was last time.
Yeah, it took her months before she really felt well again.
It must have been a really rough experience for you. What was the worst thing you remember from that time?
The worst thing was the pain, and I had to have some blood transfusions. I bled quite a lot. The radiotherapy to my pelvis took a lot out of me. It felt like a really bad sunburn. It really interfered with our relationship. I was so sore down there, I couldn't bear for him to touch me.
Must have been really difficult for you.
For both of us.
Well, the good news is there are many more options for pain relief now.
Really? How do you mean?
Well, you don't have to wait for the nurse to give you medication anymore. You can give it to yourself through the use of a special machine.
Oh, really?
Yeah, it's called a PCA, and you can give yourself medication when you need it just by pressing a button which is on a cord which is attached to the machine.
So I can't give myself an overdose?
No, it's really safe. It's specifically programmed for you.
That would be... if I don't have to have so much pain, that would be great.
Yeah, that sounds really good. Can I have some too?
Sorry, unless you want some surgery as well. It's specially locked so only the nurses can get into it.
Thanks, I was only joking. I've had my share of surgery lately.
So can I ask you a few questions? And if you have any questions as we go through, you can feel free to ask. Do you have any asthma? Okay, so we've got all the important paperwork done. Now, can you tell me your understanding about the surgery?
Well, the doctor said he won't really know how much bowel to take out until he gets in there. And then I'm going to have to wear this bag on my tummy about here.
Ooh.
Clifford, I know it's really hard for you too, but it is important to support Pam as much as you can.
Yes, sorry. I don't know where that came from. I do support her, I honestly do. And I want this surgery to go better than the last one. I know she suffered, and I want Pam to know I'm there for her. We'll get through it together.
Pam, it really does look like Clifford is committed to supporting you through this. And as you know, it's not going to be a picnic. It does look like you're going to have a colostomy. How do you feel about that?
Well, I don't like it, obviously. But I really can't see any alternative. Well, yes, I suppose the alternative is death.
Oh, don't say that.
Well, it's true. Isn't it, Anne?
Yes, Pam, although we can never really know what the future will hold. This is a life-limiting condition, and unless the surgeons do something about it now, the likelihood is that your future will be shorter without the procedure than it would be with.
I'm really quite rattled by the whole thing. I mean, I can't see how Clifford and my son are going to cope. He's got Down syndrome and he needs so much support. I'm not ready to die. I'm not ready. No.